Health warning tonight about certain popular medications and the risk for Alzheimer's. New research shows some drugs may actually increase the risk of developing the memory-robbing disease. TV 1055's Dr. Max Gomez explains.
Among the many ailments that come with age, there's an increased incidence of depression, sleep disorders, and sometimes anxiety. So it's no surprise that as many as half of all older adults over 65 use benzodiazepines, drugs prescribed to alleviate these problems, perhaps inappropriately and with a possible serious side effect.
How effective they are at treating those conditions is debatable, but the long-term use appears to have an association with a higher risk of Alzheimer's disease.
That conclusion comes from a Canadian study in the British Medical Journal that tracked the development of Alzheimer's disease in a sample of elderly residents in Quebec. They found that past use of benzodiazepines for 3 months or more was associated with an increased risk for Alzheimer's, and that the risk went up with longer use.
My mother was suffering from dementia for about the last 5 years of her life.
Llewellyn Barkan is the president and CEO of the Alzheimer's Association in New York. She saw firsthand the association between her mother's depression medications and dementia.
My mom took these kinds of medications for many years. I found many bottles of prescriptions of these kinds of medicines, and I was very upset about it. By the time I saw that, she was already beyond where I could have a conversation with her.
But doctors caution that this association does not necessarily mean these drugs caused Alzheimer's. It could be the underlying depression or anxiety is what's actually leading to dementia, and the medications are simply a reflection of treatment for those problems. Either way,
having a discussion with your doctor about whether you still need to take them and whether there are other alternatives seems to be a very important conversation you should have.
In fact, the American Geriatrics Association now includes benzodiazepines in its list of inappropriate drugs for older adults precisely because of their unwanted cognitive side effects. But do not stop or change your medications without first talking to your doctor. Dr. Max Gomez, TV 1055.